Hello, this is Richard Jacobs with the Finding Genius podcast, part of the Finding Genius Foundation. I have Dr. Gary Foresman, MD. He's a medical doctor and internist. He's the founder of what's called Middle Path Medicine, and we're going to talk about his integrative approach to cancer therapy and regenerative medicine. So, Gary, thanks for coming.
It's great to be here.
Yeah, if you would, tell me, is your practice just clinical or is it research as well?
It's entirely clinical practice. Middle Path Medicine has kind of been, it's actually been my business name for almost 12 years now, I think, as far as that goes. And kind of this approach where I do my own practice where it's, for quite some time, I had heard people saying, hey, Western medicine says this, and they kind of point to one side, and natural medicine says this. And the truth I've always found is in the middle. And obviously in a very polarized world, Middle Path Medicine is almost like an anomaly.
Well, standard of care and everything is like, it's just radiation, chemo, surgery.
And that's what we try to get across to people is that this is what standard of care. If you see an oncologist, even if you see 3 oncologists and they go to the best centers in the world, you're going to get basically one opinion about what to do, and that there's many other ways of looking at cancer out there.
So what is your approach? How do you look at cancer?
Well, and I know I shouldn't say I know this. I've looked at a few of the podcasts, and you've had Thomas Seyfried on and the metabolic approaches to cancer. And I think that is a part of the answer to looking at how do we look at this disease we call cancer, and how do we transcend some of the thoughts both in Western medicine, and also you see the same world in the natural medicine world too, where if you go to an integrative cancer conference, if you want to start a fight, just start talking about diet, or a bunch of natural people that we're so attached to our approaches that sometimes we don't bring the person into the conversation. So in terms of my approach to integrative cancer therapies is that the person is there to make the choice about how to approach their cancer. And sometimes that means a more Western approach than I would do. Sometimes it means even a more natural approach when I think a certain form of targeted chemotherapy for their very specific form of cancer might be the better option. So it's patient-oriented, which is really what integrative medicine is supposed to be, which is providing tools to your patients and allowing them to make better informed decisions about how to approach cancer. I mean, we can dovetail off of that, but it even comes down to the diet approaches, Yes.
Well, in regards to diet, I mean, if you live, 85 years, the only thing that goes into your body is liquids, air, and food. So how could it not affect you and all your cells? That makes no sense, but I guess that's the...
Well, again, goes into that. Within natural medicine, there's this basic tenet is that nutrition treats people and not diseases. And it's one of the things I really try to focus on with people, because if they've come to me and they say, Gary, or Dr. Foresman or whatever they're saying, Gary, how do I approach heart disease? What diet should I have for heart disease? Which diet should I have for cancer? For the majority of people, they're missing the point. It's which diet should I have for me? Okay. Because, and we'll of course get to later stage cancers in just a second, but because the basic truth is nutrition treats people and not diseases. And through the transitive property, if they give the right nutrition for that person, then you will find that form of nutrition will treat that cancer. And of course, as you probably are well aware, an ounce of prevention is worth a pound of cure. So that form of nutrition is going to be right for them for prevention as well as treatment. And what that means is, so back to my experience going to many, many integrative cancer conferences, and the thing I was saying about the attachment that different doctors have to their dietary approaches, because they still are doctors out there in this world who are still afraid of fat, believe it or not. They think eating any fat is a cause of cancer, eating any animal protein cause of cancer. Of course, there's the fungal theories and a whole variety of other ones out there that each doctor group tries to, sell to their patients that you have to juice to treat cancer. You have to eat this way to treat cancer. And of course, for the majority of people, essentially they've become a disease that so happens to have a person as compared to a person who so happens to have a disease. And that's where we lose it in Western medicine, especially, is we're treating diseases. We're not treating humans. Because as you well know, each human who has any disease, and this is true for cancer, for heart disease, for anything, autoimmune disease, is you're really trying to diagnose the person and not diagnose the disease. And so And of course, and this takes us to the metabolic approaches to cancer, the further you go along in a disease, the more serious a disease is, it is important to treat the disease more so than the person. Because the kind of joke goes like this. If somebody is hard to stop beating, you don't ask them what body type you are before we do CPR. We do CPR because we have to save your life, and your history is kind of irrelevant at that moment, assuming we want to save you.
I mean, regular medicine is fine with emergency acute stuff, but this is more chronic. So Again, what is your overall method for treating people? How do you assess them, first of all?